5 steps to opening your own non-medical home care business. More than 1 in 8 Americans today is over the age of 65. This number will increase to about 1 in 5 by the year 2030. As a result, it's no surprise that financial opportunities in the elder care business are booming. Non-medical home care has become particularly attractive as a business opportunity due to the preference by many seniors to remain at home as long as possible. In addition, the cost of entry into the home care business is relatively low. While franchise opportunities in home health care can be expensive, investing in a non-medical home care membership organization, which can help new owners learn the business, secure proper licensing, and get ongoing support, is much more affordable. If you're interested in starting a senior home care business, here are the 5 steps to follow. Step number 1. Understand the clear differences between medical and non-medical home care. A medical home health care agency provides skilled care to patients. This may include nursing care, physical or occupational therapy, or hospice care. Reimbursement, in other words, the way you get paid, is typically through Medicare, Medicaid, or third-party insurance. Licensing for a medical home care agency can often take several years to achieve. Meanwhile, a non-medical home care agency involves such services as bathing, grooming, dressing, meal preparation, light housekeeping, and companionship. Non-medical home care agencies are compensated through private pay. And licensing, while often required, tends to be less rigorous in most states. Step number 2 for opening a non-medical home care business. Decide on the structure for your organization. Unless you're prepared to start a home care agency without any training and support, there are 2 options: a franchise or a membership model. In addition to the disparity in terms of cost, there are several other differences. Franchises in the home care business exist both regionally and nationally. Franchises provide training and support, but they also tend to place lots of restrictions on a franchisee's independence. The corporate office must be consulted on most decisions, ranging from how you market yourself to who you can actually sell your franchise to. And of course, franchises charge ongoing royalty fees. A membership organization, on the other hand, typically provides the same services to its members while allowing them to make more of their own decisions. And a big benefit is that a membership organization does not charge any royalties. Step number 3 to opening your own non-medical home care business. Choose the membership organization or home care franchise that fits you best. For example, if you've decided on joining a membership organization for your senior care business, talk to the principals at those organizations you're considering. It's important that you find out which organizations are led by people who not only have experience in helping small business owners, but actually have experience working in the home care industry and those that can put themselves in your shoes. You'll also want to talk to some of their members to see what they say about the training and the support that they've received. Be sure to ask questions such as, is their training comprehensive? Are questions answered completely and expeditiously? And has the organization helped them become successful? Step number 4 to opening your own non-medical home care business. Recruit and properly train your caregivers. You're going to need to have your people in place before you can start marketing your services to your community. It's important to remember the people you send to a patient's home are an extension of your organization. Your people will determine your reputation and constitute the best sales and marketing tool you have. That's why it's imperative to spend the extra time on finding and then properly training the best possible candidates. And finally, step number 5 to opening your own non-medical home care business. Understand the needs of the customers you're trying to reach. The most successful home care agencies do an excellent job of treating their patients' families like they would want their own family treated. You want to convince them, and the hospital discharge planners, geriatric social workers, and other professionals who refer their clients to home care agencies, that their elderly loved ones are safe with you and will be taken good care of. So there you have it. 5 tips to keep in mind when considering opening your own non-medical home care business. To receive a free information kit, call 1-800-270-6949, extension 101.